I'm Sila, and this is Lorenzo. We are doctors looking for a way to combine our passion for medicine with our love for exploration. We picked up our lives and sold all our stuff to start a new adventure. Subscribe to follow along.
It was a great day, a tiring day. But a great day nonetheless.
What did you do?
Saw 26 patients and signed up 10 patients for surgery and did all of their biometry and all of their IOL calcs. Set up the OR for tomorrow. That's basically it.
What is that?
It's a folder of all the patients that Sean wanted me to follow up on. I spotted our little swimmer. There he is. Swimming some laps, having a relaxing morning.
Like clockwork, as if they knew Sila was a cat person.
What am I supposed to do?
Okay, so welcome to the Chuuk State Hospital operating room. I wanted to show you some of these darts that are used here and fired via slingshot at people that the lead surgeon has collected over the years. So these were brought over from the Philippines. They originally were used for killing chickens. They're fired via slingshot. This is a knife that was removed from somebody's body. But these were all extracted from people over the course of the years that this surgeon has been here. I think he only started collecting it in the last few years. And this is just some of them. There's actually, this box is just full of darts. Look at this one. This one just looks evil. It's just brutal. Usually it's related to alcohol or drug use or clan fights between families. It's almost like an equivalent of gang violence here. Luckily, now it seems like that's calmed down quite a bit. It was a lot worse years ago, but we still have the remnants to show for it. We like to get to the hospital around 8:20, and nobody is ever here on time. And so we tend to linger by the door of the clinic. Paperwork, paperwork. Having a 3 out of 10 mental breakdown at the restaurant right now. Why?
Because we've been waiting for so long, and this will be our first time eating pizza since October. And now, while we're waiting and we're starving, what we decided to do was play a game called Let's Talk About All of the Food We Miss. And naturally, we started with Taco Bell bean burritos, no onions, extra cheese. We then progressed to talking about our favorite breakfast, fufu, my aunt, and her breakfast. And then we totally swan dived into the pit of despair when we started talking about our favorite yogurts. And now I am debating screaming at the top of my lungs versus perishing in my chair, and we'll find out soon enough which one will prevail.
Tune in next time, with Ball's Hysterical Corner. So excited.
Our first pizza.
First pizza we've had in a few months in a new diner here. We will be happy with anything at this point. And now Sila looks at her box and takes a pen. She taps some things on the box. She shushes her husband away. Sila by herself setting up her OR. Just doing 10 people's jobs. Sila never let anybody say it's not my job. Putting some sterile drapes on the table so that the sterile supplies can go on there. Fabulous technique. 10 out of 10. I just went to the store to re-up on peanut butter, and let's see what Sila's doing.
PB&J made by my husband.
Looks good on video.
The size of my face. This is the micromedical device. This is what we use through the Moran. It's really amazing. It allows me to do an A scan, keratometry, and a B scan. We have a couple different probes here. We have the keratometer, USB connection to the MMD. You can see here, that's the keratometer. You hold this up close to the patient's eye and it takes measurements of the corneal surface. It gives you the steep and flat axis, etc., just like a traditional keratometer would. You have a B scan. This works similar to an ultrasound, but it's more specific to the eye. So it allows me to look at the intraocular tissues if there's some anterior segment pathology, like a really dense cataract. All my patients have dense cataracts, or some sort of chronic corneal scarring. There's a lot of trauma here, so we get to use the B scan quite a bit. Almost all my cataract patients get a B scan. And then we have an A scan. So the A scan probe is a lot smaller than the B scan, you can see, and this allows me to take the axial length. It allows me to see the anterior chamber depth, the lens thickness. And then I take all of those measurements, of course, and I put them into my IOL calculator manually. So let me show you the platform. I made my own surgery card based off of an old template from Moran. So I'll put all of that information on these surgery cards. So I just made a very basic surgery card, and I make a folder for all of my patients with the surgery card, and I'll put in all of their information, including their lens information. I'll write a little note to myself about the exam, and then I'll put the operative notes, and then this stays in the patient chart. The most important here is the pre-op blood pressure and then the blood pressure day of surgery, because a lot of our patients have very, very high blood pressures, and I avoid operating in anyone over 180 over 100.
So here we are in Chuuk, Micronesia. We are accompanying Sila for her inaugural running session. We are a little intimidated because we were told that it's inappropriate to wear shorts. So we went to a store and bought her men's swim trunks. So it's kind of hilarious, her style right now, but it's like 90 degrees and she's out there. So she's crushing it, and it's a beautiful day. It's Friday afternoon. Sila finished her clinic, and I'm going to check and see if she is almost done and ready to go for the weekend. This weekend we are going to Jeep Island. Super excited for it. It's a little desert island in the middle of the lagoon. Down into this very lovely basement space. Who is here? I see evidence of ophthalmology. Wow, this looks really fun.
We are preparing all of our charts for next week's OR. So I am going through and doing all of the fun IOL calcs.
This is why emergency medicine is better, because once you leave work, you're done and you can just focus on letting go of all the traumas you've had for the day.
On repeat, it's not.
Do we love this song? By the rivers of Babylon.